You're talking about a lot of lab work. Let's talk about, and I'm going to turn this over to both of you for your thoughts on where this is going to go. Antibody tests, so we're doing swabs now. We're doing saliva tests. A lot of people want to know, hey, have I been exposed? Am I, quote unquote, safe? Where do you think we're going to see that go in the next few months?
So I'll start with antibody tests. So we were one of the first states to incorporate some form of antibody tests early on. And the data is quite not there yet. So we have to make sure that clinical providers are involved in interpretation of the test. We did start with the rapid serology test because we needed, in certain situations, that quick turnaround time in terms of results. And we thought it was very appropriate for long-term care facilities or situations where we're concerned about an outbreak. And it was used very successfully. But there was a challenge with interpretation. And, with discussion with our subject matter experts within the state, also involvement with CDC, we were very comfortable with our schema regarding the rapid serology test. As we're moving forward and the disease it progresses, there is a change in focus. The PCR test is probably the test that we most likely will be using during this time, but I know there's some interest in serology testing. Our state lab does have the ability to test for antibodies, specifically the IgG, but after multiple discussions with federal partners, state partners, our subject matter experts, we're still not sure what the serology test tells us. It does kind of give us a certain sense whether there's been a previous exposure or potentially an acute exposure or an active exposure, but it doesn't mean that you are immune. And I want to make that very clear because there have been many questions through the public forum, through providers as well too. Does an IgG specify immunity? And the answer is we're not sure at this time. Our recent discussion with CDC, they are interested in doing more antibody testing to kind of give us a sense whether there is some sense of immunity with IgG.
Thank you. Dr. Tam, anything to add on the antibody tests?
I think that the answer I would give is this, AJ, and certainly a test is used to decide based upon what we want out of that test when you're a physician or a healthcare provider. And so the antibody test at this point is, to me, primarily one that is focused on looking at the public health perspective. Who's been infected and who hasn't, who may be quote unquote immune or who hasn't. We don't know the answer to that. So from a health systems perspective, looking at it from what we need out of a test, it really is whether someone is still actively infected and has the virus, and that's still that PCR test, which is the swab that goes in your nose or your throat. Because for me as a health system provider, the question is, are you sick right now? And how do we take care of you when you come into the hospital? Do we put you in isolation? Do we put you in some kind of other situation? And so for us, that is the test that we use primarily in the health system. And that's why we're being very careful, because those are still, unfortunately, either A, limited in terms of use in-house, or B, can send someplace but take 2 to 3 days for the results to come back.
And I'd like to add something, if that's okay. I think Dr. Tam put a good point. Is the fact is, there are different objectives with testing. From a public health side, my team side, we are looking for community surveillance. We're looking to kind of figure out how many people have been exposed and not. The antibody test may be suited for that, but again, the antibody test is not a diagnostic tool. Dr. Tam, who's looking at individual patients, he needs a diagnosis. So that's where the PCR plays a bigger role. So it's a great point. Thank you for mentioning.